welcome to the Physiatry Mentors. I'm Dr. Sheena Bhuva.
I'm Dr. Benecia Williams.
And together we are
Benecia.
All right, so hope everyone had a safe 4th of July weekend. Exciting guest today who's going to be joining us is Dr. Tyler Bates. He is a U.S. Air Force flight surgeon who will be applying to PM&R next year. So Dr. Bates, thank you so much for your service, and we're looking forward to hearing more about what exactly you do. So I'll let kind of Benecia take the next steps here.
Yes, Dr. Bates, thank you so much for joining us. And like Dr. Bhuva said, thank you for your service. We appreciate you. So tell us a little bit about your educational background. Tell us where you went to undergrad, medical school, your intern year.
Oh, yeah, absolutely. Thanks for having me. You guys are putting forward a great resource, and I'm hoping that I can help add to this resource because I know there's a bunch of military members that are also interested in PM&R, and it's kind of one of those forgotten specialties. And well, I think it's kind of forgotten also in the civilian world too. So we were talking earlier, I grew up in Idaho. I stayed local, went to Boise State, decided to save money, had lots of schemes with that as well. Just kind of thinking back on this, I've been scheming for 13 years planning, and I'm still in the middle of planning on trying to get somewhere. And during that time, I actually worked as a physical therapy aide, which is what inspired me to actually pursue PM&R. I saw so many people that could utilize the non-operative management first, or then had surgery and then needed more additional management. I happened to get accepted to Rocky Vista University. It's a DO school in Colorado. I didn't really know anything about osteopathy at that point, but I was quite happy to have discovered it. I love OMT, found it quite useful. And then Rocky Vista was great, being in the mountains of Colorado, being able to have a little bit of fun. Did as much as I could to take advantage of learning opportunities and a little bit of play opportunities. And then being from the West, I decided to move all the way out to the middle of nowhere, Pennsylvania for my internship. I did a rural transitional year internship associated with UPMC in a town called Altoona. It was a well-rounded intern program because as flight surgeons, we kind of have to do anything. So I wanted to be prepared, and then also wanted to have an associated PM&R program that I could meet people and network in. So as I said, I was planning from the beginning, and we're still in the middle of it.
Yeah, I like it. I like a planner. I think Benecia and I are both hardcore planners. So, so why don't you go ahead and kind of tell us, why did you decide to enlist in the military, and why specifically the Air Force?
Yeah, so I am actually a military child myself. My dad was a flight surgeon, and then he did PM&R, which is also how I know about it. So I'm not actually that creative, but that's why I joined the Air Force as opposed to the Navy, which is what he did. I had to be a little bit different there. And actually, we right before I started med school, we were on a bike ride, and he's like, "Hey, I want you to rethink and actually reconsider joining the military." He's like, "I know you've thought it through. You're going to go straight through. You want to do PM&R, but think about it, get a little bit different life experience and think about it." Fast forward a few months, I was sitting in cardiology lecture. I remember this part vividly, not the lecture, but I realized, I'm going to graduate from med school, go somewhere for residency, probably move home, take over my dad's practice, retire, and die. I thought that sounded boring, so I called the recruiter the next day. I only considered joining the Navy and the Air Force. Part of it is a lot of branches have their biases, and nobody really likes the Army. Everybody makes fun of the Air Force, and then the Navy is just off on ships. And so the Navy had filled up all their scholarships since I had applied late, but the Air Force said, "Hey, you've already done all of your security clearance paperwork for the Navy. How about you just join us instead?" And so that's how I ended up in the Air Force. Though I always liked planes, I actually considered being a pilot myself. So joining the Air Force was a good match.
That's very cool. I grew up in Fairfield, which is very close to Travis Air Force Base. So I've had a lot of friends and family in the military. I'm sure you've been there. It's a huge Air Force base in California. So tell us, you've now completed your intern year, you're telling us, and you're currently practicing as a flight surgeon. Tell us exactly what that is and how long you've been doing that.
Yeah, that's a great question. What exactly is a flight surgeon? It varies a little bit by base, but the summary is we are the primary care docs for pilots and flight crew. It varies. The missileers that operate the missiles, the guys flying the drones, pilots, the special forces guys, all of those have special duty considerations, and we are considered their primary care doctors. So that's kind of the normal clinic thing we do. We take care of them, but we do a lot of other things. We do occupational medicine. First and foremost is we have to figure out what our patients do. So a great part of the job is I have to go fly for 4 hours every month. I know it's a really big sacrifice we got to make. So I fly 2 different jets at this point in the back as a passenger. One of them's a nice business jet, and the other is actually the T-38, which is a supersonic jet trainer in the back, hence where the selfie came from. But that's part of it. We have to go visit the air traffic controllers, make sure that their shops are all clean, occupational standards. We do some sort of OSHA type visits. We do public health inspections, making sure that the food's good, adequately stored. Let's see. I also wrote down other things we did because there's a lot of things. And we're kind of honestly the go-to doc. When something comes up that they need an opinion of, because we're out there, we're seeing the people that are doing the job of the Air Force. We kind of know how that is. We're kind of the consultant type doc. Hey, what's going on out here? What's the feeling of this? What are the concerns? But there is some variation by location and what the mission of the Air Force Base is. You mentioned being from Travis. Travis is a really big base, but they're pretty much the Pacific Ocean, or the receiving end of anything on the Pacific Ocean. So the military members in Hawaii, Guam, Japan, Korea, if any of them get sick and need to come back stateside, they usually pass through Travis. So those flight docs not only are taking care of the pilots there, but they're also kind of involved in the transport of people back home. Whereas I'm at a training base, I don't have to make those determinations.
And so like a flight surgeon can be like any specialty, or, is it like family medicine and those are the, the physicians that end up like staying and being on as being a flight surgeon? Because, you eventually want to do PM&R. So are there people that just, that's what they do, that's their career, is being a flight surgeon? Or is that like a stepping point?
Absolutely. There's actually a couple different routes. I'm what we call a GMO, a general medical officer, completed an internship. For the Air Force, it's then 6 weeks of training minimum. There's some additional training courses that we do. The Navy is about 6 months of training. The Army is somewhere in the middle. So that's kind of the basic, and that's probably what 70 to 80% of the flight surgeons are. Family medicine is a pretty big feed in. They've actually started recruiting a lot of pediatricians to try to be flight surgeons. Well, this is a deeper subject into it. We can get back to that in a minute. But I've met OBGYNs that have decided, hey, I want to do flight medicine instead. It's a little bit more business hours, not as many deliveries in the middle of the night. Orthopedic surgeons. So you can pretty much do any specialty and then go into flight medicine, but most people usually start as a GMO. Those that really love it will do actually residency in aerospace medicine. It's a 1 to 2 year residency. Some do a combination of residency in aerospace medicine with family medicine. So there's a whole variety of options.
Neat. Okay. So, you talked about, so you're going to be applying to PM&R next year. So is there like a requirement that you have to be a flight surgeon for a certain amount of years before doing that? And then when you do apply, I was doing some research. I saw that there's really only one PM&R residency program in the military, and that seems to be at Walter Reed. So can you apply to that program and others, like in the civilian kind of world? How does that work?
Yeah. So your first question, You need minimal time being a flight surgeon. At least in the Air Force, it's usually 2 years minimum. Basically, they made the investment to move you somewhere. They don't want to turn around and move you within the 2 years.
Yeah.
It also, yeah, I mentioned that it was 6 weeks, but it was closer to, it was a little over 3 months by the time I finished all of the additional courses. So, I mean, you're working for what, maybe 9 months and then moving somewhere else. As far as the military match, basically overall background information on the military match. Every branch does it, and they have a document called the HPERB. I don't know what it stands for. Everything's an acronym in the military though. And it comes out every year. It came out a couple months ago, and it says, we will be taking 15 people to do orthopedic surgery. 10 of them are going to be going to this center. 5 of them can train in civilian programs. And it goes through every specialty. Unfortunately, in the Air Force, PM&R is not one of the specialties that is allowed at all. In the Army, it's allowed. They take 5 people a year for that. They take 4 people coming in categorical, and they take 1 person that's been either a flight surgeon or a battalion surgeon. The Army has a couple other options for GMOs. And then the Navy, every 3rd year or so, they'll take somebody for PM&R. And yeah, that's all at Walter Reed. The Army has all of the positions for that. The Air Force usually doesn't have as large of hospitals, so they'll outsource maybe 25 to 50% of their residents to civilian training. But yeah, all of it comes down to that document. And so for me, I had to do the military match initially. I knew I wanted to go civilian for my transitional year. I had to apply to the military match with my first match choice of being civilian deferred, and then backup was Travis and then San Antonio. And they said, hey, we need to send half of you guys to civilian, and you actually want to go civilian, go for it. So I was competing in both matches simultaneously. Some people think that they're shoo-in in the military match, and the match day comes out and they find out they have to scramble and submit their applications on the civilian side, which is kind of hard considering those results come out December, January timeframe. So you kind of have to scramble and get some interviews in. But yeah, unfortunately, PM&R is not an option in the Air Force. So
I know it is unfortunate. I have a good friend of mine, Captain Dr. Clausen. We did our fellowship with each other, and he was in the Air Force, and he really wanted to go into PM&R. When we met, he was like, yeah, I really wanted to do it, but I had to, because he had already committed to being in the Air Force, and he's like, I had to do family medicine, I had to get permission to do my fellowship. But he said he's doing a lot of ultrasound and a lot of sports medicine, essentially a lot of MSK. And he's like, PM&R would have been a perfect segue into this. And he said he probably wouldn't have even done a fellowship if he had the opportunity to just go straight into PM&R, but he's loving it and just got back from being deployed not that long ago. So he's a cool guy. Okay, so tell us more about practicing PM&R within the military. How does it compare to having a civilian practice versus practicing as a physician in the VA?
Yeah, great question. Unfortunately, I don't completely know. So I will say what I do know, kind of like your friend that did family medicine, sports med. I did try to find what replacements there were for PM&R. And I do know a little bit about that. The most common probably is the family medicine, sports medicine route. That's actually a fairly new fellowship for the Air Force. Only probably the past 5 years or so have they started increasing numbers going to a sports medicine fellowship. They also have neurology, and then usually anesthesia pain, though neurologists and family doctors can do the pain fellowship. It's out of San Antonio. They do so many procedures. So I actually spent 1 month at both Travis in neurology and 1 month in San Antonio. They do a lot of procedures, really cool, but they're kind of lacking some of the additional aspect that PM&R did, which is why I'm taking the roundabout method. A lot of people would come to the neurologist, especially that had bounced through multiple specialties. And by the time they came to him, he's like, well, let's try acupuncture, and you don't have a degenerative neurologic condition. So great, but you're still suffering from pain or some disability. As far as the Army goes, I did meet a couple of them at San Antonio. Most of them were doing outpatient type management, San Antonio, Walter Reed, a couple other bases around. Some inpatient is done at Walter Reed, and then they have a Center for the Intrepid in San Antonio. But again, a lot of that is contractors. Military practice is similar to the VA, but a completely different beast. The greatest similarity is, hey, you need something, you can walk to the supply closet and grab them a boot or a knee brace or whatnot and send them home with those, as opposed to attempting to order it and call multiple DME companies, figuring out which one the insurance contracts with. Yeah. But then you, of course, have restrictions with active duty, and especially with pilots, they can only take certain medications and have certain procedures done and stay on flying status. So you have kind of a mix of both worlds.
Gotcha. So you mentioned, you've been having this plan and you kind of have an idea of, what needs to be done. So what advice would you give to students who are interested in pursuing PM&R that are in the military?
Absolutely. Start early. That goes right along with the planning. But even if you decide later on that it's what you want to do, I think really just being aware. The biggest, probably, well, there's a lot of big things, but the biggest thing to remember is actually you match a year early if you're coming from the military. So because PM&R has categorical and advanced positions, you can go back without having to redo an intern year. If you want to do that and not have a year of unemployment, you have to apply a year in advance. So I will be applying this upcoming year, as you said, 2021, 2022 match cycle, but I won't actually be starting or done with my military commitment until 2023. And so that's because everybody will be matching as a PGY1, doing their intern year, and I'll come out of active duty service right into PGY2. So try to start early, plan ahead for that one, realize that nobody wants to redo an intern year. At least I don't. And if somebody does, then they need help. So that's kind of a really big one. I'm really glad that I found some mentors along the way that told me that, because I had this shocking realization just probably about a month ago. Oh, my application, ARAS opens in a year for me here. So that's the big one. And then keep track of what you do. We do so many things daily in work that are so many great experiences, and nobody quite knows not many people know what a flight surgeon does. And then there's so many things on top of it that you just kind of have to keep track of those and sell those and prepare them in your application to show that you've been doing something over those 4 years. Convince people that you haven't been riding in the backseat of fighter jets for the last 4 years. There's a little bit more work. Example of what I do, I keep track of all of the visits that I have, just kind of a basic, did I do OMT on them, neck pain, back pain, sinus infection type thing. Just keep it broad strokes there. I was pulled to do admin for the last 3 months or so due to COVID, as we were changing around the way that the entire base operates and medicine operates. And I was pulled for that, and it was a lot of work. So obviously keeping track of that. Pain management champion. So analyzing the charts of those that are on opioids, seeing that they've had behavioral therapy, seeing that they've had PT. These are all just simple duties that everybody gets assigned in the military. Everybody's got to pull some slack, but just keeping track of those and making sure that you mention it. There have been plenty of former GMOs that go unmatched, and talking to program directors and that, it's because a lot of them didn't show any progression over the course of what they were doing during their time in the Air Force. And then one little secret, the GI Bill, it's mainly designed for those that enlist straight out of high school, don't get a college education. It gives them a chance to pay for education. I don't know how the loophole is there, but it is there. Even though the Air Force paid for my med school, I can still use the GI Bill to supplement my income during residency because I'm in a training program. So it's money that you earn, so you might as well cash in on it.
Of course.
Sure, that's huge, right?
And you didn't mention this, but I know following you on social media, so you have your own YouTube channel that, because of the experience that you had, being a flight surgeon, obviously you're exposed to a lot of musculoskeletal medicine. And so tell us a little bit about what you do on your YouTube channel.
Oh yeah. So I started a YouTube channel called Musculoskeletal Minute. I actually got really ambitious, decided to start it during intern year, during one of my lighter rotations, and then came hospital medicine again, and it kind of died off. So I decided to revitalize it this last year. And I think musculoskeletal medicine, I mean, you guys are in PM&R, you've gotten the extra education, but it's such a mystery to so many people. And I think part of that is my own personal opinion. There's a disconnect between what the boards test. They like knowing all of these rare degenerative musculoskeletal conditions and weird zebras, whereas 80% of people are going to suffer back pain, but there's nothing on there about a standard mechanical back pain. And so I'm just trying to simplify that, mostly towards the med student that scratches their head saying, wait, I learned all about these weird diseases, but I have to see this patient here that has this pain. What should I do? So I cover things like physical exam, and now I'm starting to get into simple reminders on OMT, just being a quick, easy way to look at it. And I'm also branching out into a podcast, which I decided to get fancy gadgets for. So I really need to get the podcast posted, considering I bought the fancy toys.
All right, let's see. Anyone from our audience have any specific questions for Dr. Bates here?
Yeah. So your commitment is 4 years?
Yes.
It's depending on how many years of medical school that they pay for ultimately?
Mm-hmm.
Very cool. So good. That is so exciting for you. And I'm look forward to the things that you have to bring to PM&R. It's going to be great.
Yep.
Walter Reed's great. San Antonio's a great program.
All right.
We have a lot of people watching. No one has any questions.
I know.
They'll come.
Got a good following here, but
Yeah.
We're kind of a little bit of a niche subject.
yeah.
I know that people are out there. We have an Air Force scholarship page, guaranteed at least twice a year. Somebody's like, hey, so I didn't see PM&R as an option. What
I know
is that?
That is crazy to me that we've talked about before we went on live, and how PM&R has flourished and how it came about because of the military, and that it's just not an option. I just hope that changes. I think we're just such a small field. People don't realize everything that we do and how it can be a benefit, but hopefully that will change in the future.
Physical therapists, right, are big things. Sorry, in the military, right? They do a lot of hands-on stuff, like I think more than they would in the civilian world.
Yeah, I think there's a physical therapist at pretty much every base. It's definitely a needed field, and they are able to practice at the top of their training. So I work closely with our physical therapist here, and she's able to order medications within limits. She's able to order MRIs. So it's something that they're able to do to be able to expand that and utilize what they've been trained to do.
So that kind of fills up the need for PM&R, kind of fills that little bit of a slot for us too. Yeah,
I think a lot of why PM&R isn't in the Air Force is probably my own opinion here, but is a misunderstanding of the specialty. Of people think, oh, PM&R, isn't that basically physical therapy? Or they think, oh, PM&R, isn't that helping stroke patients walk again and know how to use a spoon again? And there's so much in between that they don't realize is beneficial. And the military, the Air Force kind of in general likes to outsource a lot of things medically. So if somebody suffers a catastrophic accident or something like that, they generally are going to go to a rehab center and work
Civilian.
back. And yeah, civilian or one of the large medical centers, they're like, well, we don't need to keep it in a small base. Like, for example, my current base, we have 3 flight surgeons we see the pilots, the student pilots, the air traffic controllers, and then we have a PA that sees everybody else, and we have a family doctor that sees all of the spouses and retirees for the area. So there's definitely not going to be a PM&R doc here, but some of the larger places could definitely benefit from them. So it's just kind of a mix, and unfortunately hasn't been sold. Okay, so a question. Can civilians apply to PM&R military PM&R residency? Unfortunately, Walter Reed only takes those 5 Army people, and the occasional Navy person is not open for civilians. I do believe, thanks to all that PM&R Scholars has been doing, they had the Georgetown residency program on this last week, and they do some rotations at Walter Reed. So military hospitals similar to the VA definitely give you a good exposure for hands-on, no matter what residency you're doing. But yeah, they're not open for civilians to apply to the full residency.
There are, some residencies, Diana, who, like San Antonio, for example, they do some rotations. They work very closely, like with the VA, the polytrauma, unit over there. I think there's maybe like 5 or 6 residencies in the country that have a very close affiliation with, with the military, even though they're not, military residencies. But good question.
Sorry, my television turned on all of a sudden. And I'm looking around, I'm like, can you turn this television off? I'm like, how did this happen? It was very strange. Awesome. So we always ask all of our guests, 90% of the time, if you were not going to be a PM&R physician, what would you be? And you can tell us military-wise or out and medicine-wise, whatever, both.
Well, the really easy answer is I'd be a marine biologist. I'm
your handle.
I'm trying to think about other answers, but that's really what it would be.
I'm like, that's amazing.
Yeah, that one I unfortunately threw out early on in the planning stage. It's a little bit of a saturated field, but hey, now that there's social media, I could have been a famous Instagram marine biologist.
Yeah.
I thought pilot for a while. I'm extremely happy that I did the flight surgeon thing to find out that I'm glad that I decided to not be a pilot. It's great. They do an important thing, but yeah, I much rather be a doctor. And I joked around, why choose between aviation and medicine? If I became a pilot, then I couldn't dabble in medicine without getting arrested. But if I become a doctor, I can be rich enough to own my own airplane. It's a fun joke. Turns out doctors don't actually make that much money. But yeah, it's been fun to dabble in both. Yeah. Joke's on me. We don't actually make as much money as people think.
Yeah.
That is an advantage to the military. We are paid a little bit more. We're paid more than residents. It's nice to have a real paycheck, but it's also the government, so it's not quite a full doctor's pay by any way. And I'm not board certified. If I was board certified, I'd get a good bonus. But as being a 1 year out of intern, I make pretty decent money if people are thinking about that. But my advice is if you're at the beginning and you haven't signed up and you really want to do PM&R, just go through, do PM&R, work with the military population as a contractor, unless you're kind of crazy like me and you say, no, I definitely want to be a flight surgeon and then I want to be a rehab doc, go for it. But if you're really expecting, hey, this is 100% what I want to do, I don't want to work through any intermediate time, then I'd go that way. But hey, if you're already in the military, absolutely 100% follow your dreams. I received a decent amount of, hey, you should probably just do family medicine, just do that, just finish up through, don't take this little detour. But no, I wanted to be a flight surgeon and I want to be a physiatrist. So stick through it. It's going to take a little bit longer, but there's plenty of people that have done it. I've had I can think of 4 mentors off the top of my head right now that have all been Air Force flight surgeons that have gone into PM&R programs. I know on Instagram, I'm seeing all sorts of people that were previous GMOs for other services that are doing it. So you're not blazing your own path. If it's what you want to do, take the time, make sure that you enjoy it.
Great advice. All right, one more random question. I know you dive a lot. What's been your favorite spot where you have dived?
Oh man, this is the hardest question of all of them.
Good question.
I'm spoiled. We'll start it off there. So probably coolest, I got to go with Palau. Palau is absolutely amazing. It's an island in the South Pacific. So being a military kid, I was actually born on the island of Guam, and I convinced my parents, said, hey, I need to go back to my birthplace, as a senior trip. And my mom's like, okay, we'll go back to Guam and dive only if we can continue on to Palau. And I mean, who's going to argue with that?
Right.
So it's it's in between Guam and the Philippines, if you don't know where it is. It's this beautiful island. They love actually taking care of their ocean and their part of the planet. And so it's beautiful, healthy reefs. They have all sorts of restrictions against fishing and stuff. So it was amazing to enjoy. The people were enjoyable there. Yeah, absolutely amazing.
Nice. Sounds beautiful. Hopefully one of these days when we can travel again, it'll be a nice place to put on the list. So
I was going to say, Sheena, put it on the list so we can experience it.
Definitely put it on the list.
Yeah.
COVID has kind of impacted us, and I gotta say, I am really happy on my side, being removed, not able to do audition rotations. I am happy for things like what you guys are doing, what PM&R Scholars is doing as a great way to connect and interface. But other than that, COVID has been obnoxious.
That I would agree. We appreciate your support.
Yep. Well, thank you so much for joining us. This has been great. I learned a lot.
I did.
Yep, I hope our viewers did too. And so if any of our viewers do have any specific questions for you, Tyler, what's the best way for them to get a hold of you?
Yeah, absolutely. I'm open to anybody asking questions. You guys did a good job of tagging me around all of the places: Twitter, J. Tyler Bates, Instagram, Underwater Diver. If you want to see some scuba pictures in there, that's kind of my personal one. But you're more than welcome to reach out through that. And then also, as I said, Musculoskeletal Minute. It's I have Instagram, Facebook, and then YouTube, and keep an eye out for podcasts that should be on the way. But any of those methods, I should be able to get a message somehow, or they can reach out to you guys, I'm sure, and you can forward them on to me.
Yep. Great.
Awesome. Like we said, appreciate your service, and thank you for taking the time out. Next week, guys, we have a treat. We have 2 of our favorite what we would call our PGY 2s when we were PGY 3s. Dr. Keston Robertson and Dr. Nasser Ayad. How do you say that? Ayad. They're both fellowship trained, and Nasser trained at where Sheena trained at, right under her, and then Dr. Keston Robertson trained at where I trained at for my fellowship. So we'll have them both on, and they both work in academic medicine. So they do what we do, but in academics. So it'd be a good counterpoint to see.
Yep.
Awesome, guys. We'll see you guys next week. Thank you.
Thanks for joining.